which is very surprising that people don't know their own bodies. And our News 3's Jen Lewis takes a look at those numbers and spoke to local experts looking for solutions.
November just happens to be Diabetes Awareness Month, and Virginia Governor Glenn Youngkin took it a step further with an official proclamation for our state. So why is that important? Because more and more people, including a large number here in Hampton Roads, are being told they have diabetes. Cases continue to steadily increase or worsen, especially since the COVID-19 pandemic.
A number of people may have been diagnosed with diabetes during the pandemic, but instead stayed home and had symptoms. And then other people with diabetes suffered with poor control of their disease because they didn't have easy ways to see their providers.
According to a recent study in the Lancet Diabetes and Endocrinology, people who get COVID-19 have a greater risk of developing diabetes up to a year later, even after a mild COVID infection. The impacts of the pandemic as it relates to diabetes are great and still being measured. So are the ramifications of inflation. The high cost of vital tools like glucose monitors and medicines such as insulin force some diabetics to make dangerous choices.
But if you go into rationing, then you're really taking a chance because you're going to miss out what you really need. And they could end up with amputation or bad vision or, like I said, kidney disease and cardiovascular disease.
And Mr. Leonard has all four. He was diagnosed with type 2 diabetes 40 years ago.
Deep breath in and out through your mouth. People with type 2 diabetes will make some insulin, but they can't make enough to keep their sugars controlled, and the insulin doesn't work properly.
Those with type 1 can't make any insulin at all and must take it to survive. And the cost is staggering. Hundreds of dollars per month for the insured and thousands for the uninsured. Dr. Lieb suggests talking with your healthcare provider if the financial strain becomes too much. Patient assistance programs are available. They can also offer advice on affordable dietary choices to maintain glycemic control.
So we've got some inexpensive solutions for proteins, including something as simple as an egg white carton. Regular eggs can work too. We've got a fan favorite always is a simple cheese stick, lower fat. Canned tuna or canned chicken or more canned fish can work great.
Frozen vegetables are also a low-cost option, along with beans and whole grains like oats. Generally, a Mediterranean-style balanced diet is recommended to keep those sugars in check.
And with the holidays upon us, maintaining those eating behaviors can be a challenge. We've got food and recipe options for you, as well as diabetic screening and risk assessment tools in this story at WTKR.com. I'm Jen Lewis, News 3.